Dengue is the most prevalent mosquito-borne viral infection in the world and is endemic in tropical and subtropical regions of Asia, Africa, and the Americas. Sporadic local outbreaks have occurred in southern parts of the United States. Because of global warming, the geographic reach of dengue is predicted to expand beyond current regions. Dengue is a major public health problem, with approximately 3.9 billion people at risk. The largest number of cases of dengue ever reported was in 2019, with about half occurring among children and teens. Most dengue infections are either mild or asymptomatic, but approximately 25% of people will experience classic dengue fever, characterized by high fever that is self-limiting, but accompanied by headaches, retroorbital pain, rash, and other flu-like symptoms. The dengue virus has 4 serologically similar but antigenically distinct serotypes: DenV 1, 2, 3, and 4. Primary dengue infections tend to be mild, but people who get secondary infections with a different serotype years later are at risk of developing more severe disease. Severe disease, such as dengue hemorrhagic fever and/or dengue shock syndrome, occurs in less than 5% of symptomatic cases. Severe dengue is associated with higher viremia and is marked by abrupt onset of bleeding manifestations with or without hypotension or shock during defervescence. Severe dengue is associated with a higher risk of hospitalization and death. Children and adolescents living in hyperendemic areas, where all 4 dengue serotypes are circulating, have an increased likelihood of severe disease because secondary infections with different serotypes are common. Because it is challenging to control the main mosquito vector responsible for dengue fever, and there is no appropriate treatment for this infection, development programs for pediatric dengue vaccines are underway. CYD-TDV vaccine is a recombinant, live attenuated, tetravalent dengue vaccine, which was approved by the US FDA in May 2019 for use in children ages 9 through 16 years living in dengue endemic areas with a laboratory-confirmed previous dengue infection. A major limitation of this vaccine is that for children with no prior dengue exposure, CYD-TDV vaccination may result in higher risk for severe dengue and hospitalization. Other chimeric live attenuated dengue vaccines currently in clinical development include TAC-003, TV003, TV005, and Butantan DV, which is lyophilized formulation of TV003 admixture.